You know, we are 2 years into the pandemic, and researchers are shifting their attention to the long-term consequences of contracting COVID. Experts have known for a while that people with diabetes are at a higher risk of catching COVID, but now new studies say COVID may lead to a higher risk of diabetes. Dr. Ralph Wong with Mary Freebed joining us live now this morning to tell us more about these studies. Sir, good morning to you first. Can you tell us something more about this connection between COVID and diabetes? What are you seeing from where you are?
Sure. So I work in inpatient rehab hospital, so patients with severe COVID, if they're too weak to go home, come to us for recovery. So I am seeing of those patients coming to us with COVID, about 30 to 40% already having diabetes.
Okay, and these new studies definitely highlight some important consequences of long COVID. What can be done to sort of prevent this, or can anything?
Yeah, I mean, I think one of the main ones is, of course, vaccinations. And as far as the recent studies that you were talking about, now that we have more data, it does seem like with having COVID, you have a 34 to 40% increased risk of getting diabetes. So if you had initially just a 5%, now it's closer to 35%. Which can be kind of scary because diabetes really damages our blood vessels in our body, which can ultimately lead to stroke and heart attack, the number 1 in 3 killers in the United States, unfortunately.
Doctor, is there a certain demographic that is more susceptible to getting diabetes after contracting COVID?
Yeah, I would say certainly anyone who's older, anyone who has heart disease, they can be at higher risk for diabetes, certainly if you're not eating well, and those are all increased chances. But then again, and then of course just having COVID, if again, not being vaccinated or maybe not masking in a high prevalent area, that can also increase COVID and therefore diabetes.
Is it something that the public or children or young people should be concerned about? Should parents be concerned that if their kid gets COVID, that they too will possibly be at risk of having diabetes or getting diabetes?
Absolutely, yeah. So I think now, certainly there's a fear of being hospitalized or, God forbid, dying. But now if you get diabetes and it doesn't resolve, 10, 20 years down the road, you're at increased risk of stroke and heart attack. So yeah, I think that really is even more motivating to avoiding COVID, getting your vaccination, or at least getting that medication immediately after finding out that you have COVID.
Okay. Dr. Wong with Mary Freebed. Dr. Wong, thank you so much, and thank you for the work you're doing, sir.
Absolutely. Thank you.
All righty. Take care.